talking about X-linked hypophosphatemia. Now, what is this exactly? We know about rickets, where there are bony deformations which we see in the people. But there is also a kind of rickets which is caused due to deficiency in phosphate. Now, there are two kinds of such presentation. One presentation comes in a young adult or a child, where we can see these rickets, and we can also see that they have pains, joint abnormalities, bony projections, changes in the bone densities, and all of these can indicate towards an X-linked hypophosphatemia. Testings are done, which can be both biochemical testings and genetic testings. These are normally X-linked, which means that the gene is on the X chromosome. Normally there are two genes, one is the FEX and one is FGF23. These two are genes that actually help in this phosphate metabolism, and mutations in these genes can cause these deformities which are present. Good thing is that there are clinical managements available. Depending on the type of mutation, there are very standard guidelines that can be present, and the conditions can be addressed. Also, these are inherited disorders. X-linked hypophosphatemia can be both autosomal dominant and autosomal recessive. In the autosomal dominant form, it will pass from a man to, if it's in a man, it will pass from man to the daughters and sons and everyone. But if it is in an X-linked recessive manner, then majorly male children would be affected. But this does not mean that female children are not affected. Very, very rarely there is a process which is called lionization, where a female child can also be affected. It is possible that we can diagnose this if you have a family member who has this condition and we know the mutation, then we can diagnose it. Many a times this can also present in utero.
So, as Dr. Deepanjana correctly pointed out, it is possible to detect X-linked hypophosphatemia prenatally. Hello, I am Dr. Shumona Haq, Consultant Fetal Medicine at Neotia Bhagirathi Newtown Hospital. So, if any of the prospective parents or their family members are suffering from X-linked hypophosphatemia, they might opt for prenatal diagnosis. So, what is prenatal diagnosis? Prenatal diagnosis is the process by which it is possible to detect before the baby is born whether it has a certain genetic disorder. In this case, it is X-linked hypophosphatemia. As a part of normal pregnancy checkup, your doctor sees the baby's growth and its development by the help of ultrasound. So, in cases of X-linked hypophosphatemia, the symptoms may not be apparent right from the early time of pregnancy. So, it is the best way to determine X-linked hypophosphatemia is through prenatal genetic diagnosis. So, how this is done? The DNA of the baby is examined to see whether the baby is having X-linked hypophosphatemia. This DNA can be extracted in two ways, by amniocentesis and by chorionic villus sampling. In amniocentesis, a needle is inserted into the mother's abdomen and the fluid in which the baby floats is collected. This can be done from 16 weeks onwards. This fluid is sent to the lab for examination. In case of chorionic villus sampling, a needle is inserted abdominally or through the vagina, and the part of the placenta, a placental biopsy is collected, and this is sent to the lab for detection of any genetic disorder. In this case, it is X-linked hypophosphatemia. Early detection helps the parents to take certain important decision. It prepares the parents, and in many cases, the treatment can be started as soon as possible, which in cases of X-linked hypophosphatemia is extremely helpful. Thank you.